Hi, Dr. Noel Williams here, February 25th, 2025. A brief little talk on collateral cancer care because Dr. Zubin Marolia from Mumbia, India, one of the lead integrative oncologists in India, Europe, and the world, will be giving a lecture March 3rd at 5:30 p.m. It's free. Everyone is welcome who has interest in anything with collateral care in general to allopathic care, but especially for cancer care. That talk is going to be at our new office, 10029 North Oklahoma Avenue, Oklahoma City, Oklahoma, 73114. That's our new location. It's about a third of a mile away from our old location. You can get there either from Oklahoma Avenue on Britain or on the Access Road on Broadway Extension and taking a right where there'll be a sign. So anyway, hope to see you there. Dr. Marolia is a wonderful person, great lecturer. He lectures around the world. He's going to talk about mistletoe. We think a lot about cancer therapies these days. What's the current trend? All these new immunotherapies. Immunotherapies are things that get your immune system to attack the cancer. What's the whole problem with chemotherapy? Chemotherapy damages your immune system, but what kills the cancer? Your immune system. So as you're damaging the cancer, that helps the immune system recognize broken down antigens and proteins from the immune system to attack and kill the cancer. Your immune system kills the cancer, not chemotherapy. So when you add something like mistletoe, you're going to rev up your immune system to help attack the cancer. So great collateral or adjuvant therapy. It's not well adopted here. 30 to 40% of all chemotherapeutic patients or cancer patients in Germany and use mistletoe with their standard chemotherapy. But again, we're kind of stuck in the world of the NIH and National Cancer Institute, which are completely big pharma driven. I'm sorry, but it's true. As I like to remind people, if you read, I'd say, Joint and Sensible Medicine, read Vinay Prasad, MD, a professor of oncology and hematology at Stanford. He gives lots and lots of editorials, which will connect you to more and more smart people in oncology who go, WTF, what are we doing, FDA? 68% of the currently approved chemotherapies have no survival benefit. Let's talk about it versus ignoring it and getting silence, which is what the NIH and FDA does. So just another way. I really still believe in oncology. I believe in chemotherapy, but it's using the right ones. That's why I use Dr. Alita Toma and Sanjay Hapani. I'm mispronouncing everyone's name, Abby Bova, and all these, Michael Kiefer at Mercy, all these wonderful oncologists. There's great oncologists out there who understand this stuff too. And so that's why we do these talks, to try to educate people. So am I missing anything on that subject, Kim, or did I do it reasonably well for someone who mispronounced two people who I talk to all the time's names?
It's fine. I'd say the date and address again.
The date and address again is 10029 North Oklahoma Avenue, March 3rd at 5:30 p.m. at our new office, 3rd floor. See you there if you're interested. Take care. Bye.